Ideas on the Go, talking about probiotics. Probiotics are the supplements people take to replenish the normal bacteria of the body. They are fairly standard of care when discussing the gut. So, for example, we know that when people take oral antibiotics for an extended period, they quash some of the normal bacteria that are in our bodies. That's one of the reasons why often women will get yeast infections vaginally while they're on oral antibiotics, because the yeast take advantage of the suppressed bacteria to overgrow. I always suggest to my patients when I'm putting them on antibiotics to take probiotics. Any severe shock to the GI system, for example, a severe gastroenteritis, can change that ecosystem of the gut. Taking probiotics can help restore that ecosystem and thereby improve how you feel and how your gut functions. The question is how this all relates to the skin. There is more and more data coming out about the skin microbiome. Microbiome meaning the ecosystem made up of organisms of the skin. There's also more and more data coming up about the interaction between the GI system, the gut, and the skin. The question is, do we yet know what to do about that? Right now, we don't know whether probiotics will help topically or orally for acne or eczema. We don't know whether improving your gut will definitively improve your skin. A lot of that depends on what the diagnosis is. Patients with atopic dermatitis histories, eczema for example, have a tendency to have bacterial colonization in their nostrils. Not bacterial infection, but a colonization. That means it's not causing any problem in their nose. However, it can cause a problem when they have something else breaking the skin. For example, if they get a Fraxel. So for those patients, we may treat them with an oral antibiotic. If you go to your dermatologist and you have a yellow, crusty, scabby rash somewhere, they may swab it for bacteria. If it's a recurrent rash or recurrent infection, that your doctor will swab your nose, because that colonization could be the source of bacteria honing in and having a party when the skin is broken, causing an infection. We treat that with oral antibiotics. We may also treat that even more commonly with some topical antibiotic within the nostrils. So before you jump on the probiotic bandwagon, please understand that we just don't have the data. And while taking probiotics seems like a very benign thing to do, in other words, something that won't cause other problems, we won't know that for a long time either. Overloading on any type of supplement or jumping on any theory while it's still a theory before we have things defined can change that teeter-totter balance, and not always in the best way. I hope that makes sense and is helpful. So that's another ideas for today. So my general recommendation to patients is wait to treat until you have symptoms that need to be treated.